Good evening. This is All India Radio. I'm Anuja Kumar, and with me is Renuka RS with the evening news. The headlines. Prime Minister Narendra Modi meets President Ramnath Kovind at Rashtrapati Bhavan. Briefs on national and international issues. Sardar Vallabhbhai Patel COVID hospital built by DRDO in Delhi in record time of 12 days becomes operational. Defence Minister Rajnath Singh appreciates efforts of stakeholders in building facility in short span of time. Government conducts locust control operations across 9 states in the country. No significant crop loss reported. Traders body CAIT urges central government to boycott China's Huawei and ZTE from bidding for 5G network in India. And CBSE partners with Facebook to launch free training program for teachers and students on augmented reality and digital safety. Prime Minister Narendra Modi today met President Ramnath Kovind. Mr. Modi briefed the President on the issues of national and international importance at Rashtrapati Bhavan. Defence Minister Rajnath Singh, along with Home Minister Amit Shah and Health Minister Harshvardhan, today paid visit to the Sardar Vallabhbhai Patel COVID Hospital in Delhi. The 1,000-bedded hospital, with 250 intensive care unit beds, became operational from today. The facility was built in a record time of 12 days by Defence Research and Development Organisation DRDO, along with Home Ministry, Health Ministry, the Armed Forces, Tata Sons and other industry players. The union ministers were accompanied by Delhi Chief Minister Arvind Kejriwal and Minister of State for Home G. Kishan Reddy during the visit. The national capital is currently experiencing a surge in the number of COVID-19 infections, with an increasing number of patients requiring medical care. An urgent need to augment the existing hospital beds capacity of Delhi for the COVID-19 patients was discussed between the Home Minister and Defence Ministries on the modalities of deploying a 1,000-bed hospital in a span of less than 14 days. Talking to reporters, the Defence Minister appreciated the efforts of stakeholders in building this facility in such a short span of time. He said over 250 intensive care units have been established in the hospital. Mr. Singh said the facility has been built in compliance with the guidelines issued by the World Health Organization (WHO).
मिनिस्ट्री ऑफ होम अफेयर्स, टाटा सन्स, इंडस्ट्रीज और कई ऑर्गेनाइजेशंस के सहयोग से ये कोरोना मरीजों के लिए एक टेम्पररी हॉस्पिटल बना है। सबसे बड़ी विशेषता ये है कि इसको 12 दिन के अंदर ही ये तैयार किया है और मुझे ये भी जानकारी दी गई कि लगभग 250 से अधिक इंटेंसिव केयर यूनिट्स यहाँ पर वेंटिलेटर्स, ऑक्सीजन और अन्य सारी सुविधाएं तो यहाँ पर उपलब्ध हैं ही। WHO की जो भी गाइडलाइंस हैं, उन गाइडलाइंस को ध्यान में रखते हुए ही इस टेम्पररी हॉस्पिटल का निर्माण किया गया है।
The DRDO was asked to establish the hospital. It undertook the design, development and operationalization of the facility on a war footing. With the permission from the Indian Air Force, the land situated near the New Delhi Domestic Airport Terminal T1 was identified and the construction work by DRDO commenced on the 23rd of June. The hospital will be operated by a medical team of doctors, nurses and support staff from the Armed Forces Medical Services, while the facility will be maintained by the DRDO. Additionally, for the mental well-being of patients, the hospital has a dedicated DRDO-managed psychological counseling center. The COVID-19 patients referred by the district administration will be admitted and treated free of cost at this facility. Critical cases will be referred to All India Institute of Medical Sciences in New Delhi. The unique centrally air-conditioned medical facility is spread over 25,000 square meters. Each ICU bed is equipped with monitoring equipment and ventilator. The hospital consists of a separate reception-cum-patient admission block, medical block with pharmacy and laboratory, duty doctors and nurses accommodation, and 4 modular patient blocks, each consisting of 250 beds.
The government today said that the number of COVID-19 recovered cases rose to over 409,000 due to collective and focused efforts for containment and management of coronavirus by the centre, along with the states and union territories. During the last 24 hours, a total of 14,856 COVID-19 patients have been cured. Union Health Ministry said there are over 164,000 more recovered patients than COVID-19 active cases. This takes the national recovery rate amongst COVID-19 affected people to 60.77%. The ministry said there are over 244,000 active cases and all are under active medical supervision. Talking exclusively to AIR News, Health Minister Harshvardhan said India's recovery rate now stands close to 61%, which is among the best in the world.
आज जो हमारा रिकवरी रेट है वो लगभग 61% के करीब जो पहुंच रहा है, ये शायद दुनिया के अंदर सबसे ज्यादा है। मेरे ख्याल से अभी इस रिकवरी रेट के आसपास केवल जो है रशिया है, बाकी सब दुनिया के विकसित देश हमारे रिकवरी रेट से पीछे हैं। दुनिया में सबसे बेहतर रिकवरी रेट और सबसे कम फैटेलिटी रेट। फैटेलिटी रेट भी हमारा जो मृत्यु दर है वो भी धीरे धीरे कम होती जा रही है। मुझे पूरा विश्वास है कि जिस प्रकार से भारत जो 135 करोड़ लोगों का देश है, उसमें जितने केसेस हुए हैं और उसमें केसेस में 60% से ज्यादा ठीक होकर घर चले गए हैं, बाकी जो हैं उसमें से अधिकांश रोड टू रिकवरी पर हैं। मुझे पूरा विश्वास है कि आने वाले समय में हम कोरोना के ऊपर निर्णायक विजय है वो निश्चित रूप से प्राप्त करेंगे।
The testing lab network in the country continues to expand. As of now, a total of 1,100 laboratories across India have been given approval to conduct COVID-19 tests, including 786 government laboratories and 314 private laboratory chains. During the last 24 hours, around 249,000 samples have been tested. The cumulative number of samples tested so far is more than 97,89,000. World's largest 10,000-bed Sardar Patel's COVID Care Centre was made operational at Radha Swami Satsang Byas in Chhatarpur area in the national capital today. The centre was made operational by the Indo-Tibetan Border Police, ITBP, in a big support to fight against COVID-19 in Delhi. Lieutenant Governor Anil Baijal inaugurated the facility, which is the largest of its kind in the world with over 10,000 beds. Adequate arrangements have been made by the ITBP at the facility. Over 1,000 doctors, nurses and paramedic staff of ITBP and other Central Armed Police Forces have been deployed at the centre for smooth operation. More than 75 ambulances will also be deployed at the centre.
ITBP said that a total of 21 patients were admitted in the Sardar Patel COVID Care Centre and Hospital. All patients are from Delhi. ITBP said condition of all admitted is stable. It said all patients are being looked after by the ITBP doctors at the centre. In a bid to ramp up the medical infrastructure to fight coronavirus in the national capital, the Delhi government has ensured a steady increase in the number of ICU beds in COVID hospitals. The number of ICU beds has increased from 60 to 180 in Lok Nayak Jayaprakash Hospital, from 45 to 120 in Rajiv Gandhi Super Speciality Hospital, and from 31 to 66 in GTB Hospital. The Delhi government in a statement said, with an increase in the ICU beds, the fatality rate in the city is expected to reduce further. It said Delhi has reported around 97,000 cases so far, and of them, over 68,256 patients have recovered. The recovery rate of Delhi has crossed 70% yesterday, and the number of hospitalized patients has gone down from 6,200 to 5,300. The number of vacant COVID beds is around 9,900, which is nearly 65% of the total bed capacity in COVID hospitals.
Ladakh is making tremendous progress in COVID-19 management. The Union Territory's health services have effectively cured 826 COVID-19 cases so far, out of over 1,000 cases recorded in Ladakh. More from a correspondent.
Union Territory Ladakh is effectively managing the COVID-19 pandemic in the region. Since the first week of March, over 1,000 positive cases have been registered in Ladakh. However, 826 active positive COVID-19 cases are cured in the UT. As over 20,000 have reached Ladakh after evacuation from various parts of country, Ladakh has seen sudden spike in number of positive cases in the month of June. However, effective implementation of SOPs and strict quarantine regulations are yielding results. Ramesh Chandra, All India Radio News, Leh.
The Uttar Pradesh government is taking all steps to contain COVID-19 infection in the state. The government has increased the strength of corona testing, and the medical screening of people is underway to find out corona active cases in the state. The healthcare teams are conducting door-to-door visits for medical surveillance. Chief Minister Yogi Adityanath has emphasized on strict adherence of social distancing norms and appealed to people to strengthen immunity power. A massive drive was carried out with plantation of over 25 crore saplings across Uttar Pradesh under Mission Vriksh Aropan 2020 in a single day today. Meanwhile, COVID-19 recovery rate in the state has reached around 68%, which is higher than the national average. Our Lucknow correspondent has filed this report.
The Chief Minister, while inaugurating Mission Vriksharopan 2020 at Lucknow today, said that coronavirus can be avoided by increasing immunity power. Referring to Ayurveda of India, he said that there are many such medicinal plants. By drinking decoction of that, we can increase our immunity. Meanwhile, Additional Chief Secretary Home Avnish Awasthi, while addressing media at Lucknow today, said that maximum 29,117 corona tests were conducted today and the figure will soon reach to 30,000 tests per day. He told that after 1,155 new cases of COVID-19 during last 24 hours, the total corona cases in the state has reached to 27,707. There are 8,168 active cases of COVID-19. MS Yadav, Yaya News, Lucknow.
Karnataka Medical Education Minister Dr. K. Sudhakar has warned of criminal action against private hospitals refusing treatment to COVID patients. Speaking to media persons in Bengaluru today, he asked people to call on number 1912 to lodge complaint against such private hospitals. Our correspondent has the details.
The Medical Education Minister Dr. K. Sudhakar informed in the press conference today that private hospitals have promised to provide 2,724 beds in their hospitals in Bengaluru to treat COVID patients. He also warned them against charging higher rate for sample testing than that prescribed by the government. Asking public not to panic, he said there are around 6,74,000 positive cases in India and 60.67% among them are cured of the infection. In Karnataka, the mortality rate due to corona is just 1.46%. Hence, he pointed out that no one must be alarmed. Sudhindra, AIR News, Bengaluru.
Meanwhile, 1,925 new COVID-19 positive cases were reported in the state, while 603 people were discharged from various hospitals after recovery during the last 24 hours. 37 more corona deaths were reported during the period. The total number of affected people has gone up to 23,474 and total number of recovered people has risen to 9,847 in the state. 13,251 people are under treatment in various hospitals in the state. The COVID death toll has reached 372 in the state. With the rise in COVID-19 cases in Kerala, triple lockdown has been declared in the capital city Thiruvananthapuram for a week from tomorrow morning. Only emergency services will be permitted. Government offices will remain closed.
Indigenous Indian COVID-19 vaccines are in the global race to end the coronavirus pandemic. The Science and Technology Ministry said that a silver lining has appeared with the announcement of Covaxin by Bharat Biotech and ZyCoV-D vaccine by Zydus Cadila. Drug Controller General of India, CDSCO, has given the nod for the conduct of the human trial for the vaccines. In the past years, India has emerged as one of the significant vaccine manufacturing hubs. Indian manufacturers account for 60% of vaccine supplies made to UNICEF. Across the world, more than 140 candidate vaccines are under various stages of development. Along with Covaxin and ZyCoV-D, 11 out of 140 vaccine candidates have entered the human trials world over. Speaking exclusively to AIR News, Principal Scientific Advisor to the Government, Professor K. Vijay Raghavan said it is important that vaccines are properly tested to ensure its quality and safety.
पहले टेस्ट होती है सेफ्टी, दूसरी टेस्ट होती है वैक्सीन में। जब वैक्सीन को इंजेक्ट करते हैं तब क्या अपना शरीर उस वैक्सीन के इंजेक्शन से इम्यून रिस्पांस चालू होती है कि नहीं। तीसरी, वैक्सीन अगर सेफ हो और इम्यून रिस्पांस इम्यूनिटी देती हो तो क्या वो फील्ड में जब आप बाहर जाते हैं काम करने में या घर में हैं या ऑफिस में हैं, अगर मान लीजिए वायरस आती है तब वैक्सीन लेने से वायरस से प्रोटेक्शन मिलती है। और जब तक ये तीनों ठीक नहीं है तब तक हमारे देश में इंडियन काउंसिल ऑफ मेडिकल रिसर्च हो, बाकी एजेंसी से पार्टनर कर रहे हैं, वो वैक्सीन चालू नहीं करेंगे। चालू करने के लिए आईसीएमआर और हमारे ड्रग कंट्रोल एजेंसी ये 3 मुद्दों को पूरी तरह से देखेंगे।
The News Services Division of All India Radio and its bilingual live phone-in program tonight will bring you a special discussion on COVID-19. Dr. Ghanshyam Pangte, Professor of Medicine at Lady Hardinge Medical College, will participate in the discussion. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi meets President Ramnath Kovind at Rashtrapati Bhavan, briefs on national and international issues. Sardar Vallabhbhai Patel COVID Hospital built by DRDO in Delhi in record time of 12 days becomes operational. Defence Minister Rajnath Singh appreciates efforts of stakeholders in building facility in short span of time. Government conducts locust control operations across 9 states in the country. No significant crop loss reported. Traders body CAIT urges central government to boycott China's Huawei and ZTE from bidding for 5G network in India. And CBSE partners with Facebook to launch free training program for teachers and students on augmented reality and digital safety. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The centre today said that the locust control operations were conducted in around 2.5 lakh hectare area across 9 states from 11th of April this year. These states are Rajasthan, Madhya Pradesh, Punjab, Gujarat, Uttar Pradesh, Maharashtra, Chhattisgarh, Haryana and Bihar. The Agriculture Ministry said no significant loss of crop has been reported in Gujarat, Uttar Pradesh, Madhya Pradesh, Maharashtra, Chhattisgarh, Bihar and Haryana. However, some minor crop losses have been reported in some districts of Rajasthan. The ministry said swarms of immature pink locusts and adult yellow locusts are active in Jaisalmer, Barmer, Bikaner, Jodhpur, Nagaur, Dausa and Bharatpur of Rajasthan and Jhansi and Mahoba districts of Uttar Pradesh. Presently, 60 control teams with spray vehicles are deployed in Rajasthan, Gujarat, Madhya Pradesh and Uttar Pradesh. The ministry said over 200 central government personnel are engaged in locust control operations. Further, 5 companies with 12 drones are deployed at Barmer, Jaisalmer, Bikaner, Nagaur and Falodi in Rajasthan for effective control of locusts on tall trees and in inaccessible areas through spraying of pesticides. India is the first country who is using drones for locust control. The Ministry of Electronics and Information Technology has blocked 40 websites of Seeks for Justice SFJ, an unlawful organization under the provisions of Unlawful Activities Prevention Act. The organization had launched a campaign for registering supporters for its cause. On the recommendation of the Union Home Ministry today, the Electronics Ministry issued orders under relevant sections of IT Act 2000 for blocking the websites of SFJ.
The Confederation of All India Traders, CAIT, has urged Union Communications and IT Minister Ravi Shankar Prasad not to include Huawei Technologies and ZTE Corporation in the bidding for 5G network in India. In a letter to the Minister, National General Secretary of CAIT, Praveen Khandelwal has said that 7 crore traders of the country request the central government not to allow Huawei and ZTE Corporation to participate in the 5G network rollout process in the country. The traders' body asserted that 5G mobile network promises super-fast download speeds and the ability to support critical infrastructure. Therefore, it is more critical from the point of accruing data. Mr. Khandelwal emphasized that several countries, including the USA and Australia, have already barred both Huawei and ZTE Corporation. These 2 Chinese entities were charged with a list of crimes, including conspiracy, money laundering, bank and wire fraud. The traders' body, CAIT, launched a nationwide campaign called Bharatiya Samman Hamara Abhiman. It calls for boycott of Chinese products in the wake of India-China standoff along LAC in eastern Ladakh. The Jammu and Kashmir police said that 2 terrorists who were killed by security forces in an encounter in Kulgam yesterday were tested positive for COVID-19. A statement issued by the police said that while carrying out the medico-legal formalities, the samples of the killed terrorists were taken and sent for COVID-19 test. Subsequently, the test reports were received today from Chest Diseases CD Hospital in Srinagar, and both the killed terrorists were confirmed as coronavirus positive.
In yet another ceasefire violation, Pak Army initiated unprovoked and indiscriminate firing along the LOC in Balakot sector of Poonch district in Jammu and Kashmir today. PRO Defence Colonel Davinder Anand has said that Pak Army initiated unprovoked and indiscriminate firing and heavy mortar shelling along the LOC in Balakot sector today at about 19:45 hours. Alert Indian Army troops guarding the fence are retaliating befittingly with equal caliber. The exchange of fire continued till reports last came in. There are no reports of damage to any property or loss of any life from our side so far. In Odisha, at least 4 Maoists were killed during an exchange of fire with security forces in the Tumdi Bandha forest in Kandhamal district today. Congratulating the security forces, Chief Secretary Asit Kumar Tripathi said that the operation has strengthened Odisha's resolve to fight extremism. A report.
4 Maoists killed in Tumdi Bandha forest area. Director General of Police Abhay informed that acting on a tip-off regarding a Maoist camp held in the reserve forest areas, a team of Special Operations Group personnel and District Voluntary Force officers had launched a combing operation in the forest in the Tumdi Bandha area of Kandhamal district. Meanwhile, an exchange of fire broke out between Maoists and Jawans in which 4 Maoists were killed. According to sources, the search operation is still going on in the area. All 4 of them are suspected to be the members of the Bansadhara Nagabali Gumusur division. Itishri Singh Rathore, AIN News, Cuttack.
The Central Board of Secondary Education CBSE has partnered with Facebook to launch free and comprehensive training program for teachers and students of its affiliated schools in the first phase from August to November this year in virtual mode. The program will cover teacher training on augmented reality and student training on digital safety and online well-being. The training program will be of 3 weeks in which 10,000 teachers will be trained on augmented reality, while 10,000 students will be trained on digital safety and well-being. The registration process for the training program will be held from 6th to 20th of this month. The program for teachers will be launched on 10th of August, while the students' training will begin from 6th of August. The participants will also receive a joint e-certificate from CBSE and Facebook on successful completion of the course. In the second phase, CBSE will introduce the training program on digital safety and augmented reality for 30,000 students in each category. Schools have to online nominate their teachers and students for the training programs.
In Jammu and Kashmir, meeting of the subcommittee constituted by the Supreme Court for Amarnath Yatra was held under chairmanship of Chief Secretary B.V.R. Subramanian at Jammu. Reviewing the preparations for the Yatra yesterday, the Chief Secretary observed that in view of the COVID-19 pandemic, the State Executive Committee constituted under the Disaster Management Act has issued guidelines which inter alia prescribed 100% RT-PCR test for all persons travelling into the Union Territory. Given the constraints, a maximum of 500 yatris only would be allowed per day by road from Jammu and Kashmir to Holy Cave Shrine. It was informed that Baba Amarnath Aarti this year will be telecast live on Doordarshan. Meanwhile, the rituals of Puja Archana related to Chhadi Mubarak for this year's Amarnath Yatra were performed in Pahalgam today. Lieutenant Governor Girish Chandra Murmu visited the Holy Cave Shrine of Sri Amarnath and paid his obeisance. More from our Srinagar correspondent.
In connection with this year's Swami Amarnath Ji Yatra, Bhumi Pujan was performed for the Chhadi Mubarak in Gauri Shankar Temple at Pahalgam today. Mahant Dipender Giri along with some sadhus performed the Puja Archana in the temple. Union Territory Administration had made elaborate arrangements for the event. Mahant Dipender Giri, while talking to AIR News Srinagar, said that he prayed to Swami Amarnath Ji to bestow peace and prosperity to mankind throughout the world. It is worthwhile to mention here that the Bhumi Puja signifies the start of annual Swami Amarnath Ji Yatra 2020. With Tasuddur Rashid from Pahalgam, this is Sunil Koul for AR News from Srinagar.
In our series, Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, Head of Rheumatology Department, AIIMS, suggested people to follow social distancing, hand hygiene and cough etiquette.
Only thing which helps is social distancing or physical distancing. Along with it, you have like hand hygiene, washing your hands very frequently, and cough etiquettes like while coughing or sneezing, just cover your face and nose. Use tissue paper or cloth, or if you don't have anything, you can just cough into your elbows. Third thing is using the face mask. For a general public, you can use cotton face mask, and then they have to be very positive. Don't give up, and surely we'll conquer over this virus.
President of Public Health Foundation of India, Dr. K. Srinath Reddy said, India is in a much better position as compared to rest of the world as far as the COVID-19 cases are concerned, and the measures taken are yielding results.
अब तक जो नतीजे निकले हैं उससे पता चलता है कि ये वायरस का प्रभाव को रोकने में हम काफी कामयाबी हासिल कर चुके हैं दूसरे देशों के मुकाबले में। आज का हालात जो है उसमें कोई संशय नहीं है कि हमारा हालात दूसरे देशों के मुकाबले में बेहतर है इस वायरस को डट के मुकाबला देने में।
The flood situation in Assam further improved today as most of the rivers are showing a receding trend. Official sources in Guwahati said that nearly 7 lakh people in 17 districts are still reeling under flood waters. No death has been reported due to floods in the last 24 hours. Nearly 5,000 people are staying at relief camps. The second wave of floods has also affected agriculture, land and infrastructures in the state. Mumbai and its adjoining suburban areas in Maharashtra witnessed heavy rains for the third consecutive day today. Mumbai recorded 129.6 of rainfall, while suburban Santa Cruz registered 200.8 millimeters in last 24 hours. Neighbouring Thane district received 161.01 mm of rainfall during the same period. A high tide of 4.63 meters was witnessed in the afternoon, causing waterlogging in Worli area of South Mumbai. We have a report.
3 days of incessant rain led to overflowing of Powai Lake today. The artificially built lake situated in suburban Powai area of Mumbai has the capacity to hold 545 crore liters of water, which is mainly used for industrial purpose. Instances of wall collapse, uprooting of trees and waterlogging were reported in and around Mumbai. In one such instance, a vacant building in Thane city collapsed shortly before midnight on Saturday amid continuous rains. Thane Regional Disaster Management Cell Chief Santosh Kadam said that there were no injuries as a single-level structure was vacated over a month ago after it was declared dilapidated and dangerous. Meanwhile, fishermen living in Mumbai's Kolaba have sought help from local administration, fearing waterlogging in their houses due to incessant rainfall. Devapriya Bhattacharjee, AIR News, Mumbai.
Now let us take a look at the weather updates for tomorrow. The national capital Delhi is expected to have cloudy sky with light rain. Minimum temperature will be 23 degrees Celsius and maximum 35 degrees Celsius. Mumbai will have generally cloudy sky with heavy rain. In Chennai, the minimum temperature will be 27 degrees Celsius and maximum 33 degrees Celsius. In the Union Territory of Jammu and Kashmir, the minimum temperature will be 25 degrees Celsius in Jammu, while maximum will be around 37 degrees Celsius. In Srinagar, the minimum temperature will be 17 degrees Celsius, while maximum will be around 33 degrees. The city will have partly cloudy sky. In Gilgit, the sky will be partly cloudy, becoming generally cloudy towards afternoon or evening or night. The sky in Muzaffarabad will have mainly clear sky, becoming partly cloudy towards the afternoon or evening. The city will witness minimum temperature of 22 degrees Celsius, while maximum temperature will be around 36 degrees. Guru Purnima is being observed across the country today. The festival is celebrated to pay respect to spiritual and academic teachers. Prime Minister Narendra Modi has greeted the people on the occasion. In a tweet, the Prime Minister said, "It is a special day to show respect to the Gurus who make life meaningful." He conveyed his best regards to all the Gurus. And now, before we end the headlines once again, Prime Minister Narendra Modi meets President Ramnath Kovind at Rashtrapati Bhavan, briefs on national and international issues. Sardar Vallabhbhai Patel COVID hospital built by DRDO in Delhi in record time of 12 days becomes operational. Defence Minister Rajnath Singh appreciates efforts of stakeholders in building facility in short span of time. Government conducts locust control operations across 9 states in the country. No significant crop loss reported. Traders body CAIT urges central government to boycott China's Huawei and ZTE from bidding for 5G network in India. And CBSE partners with Facebook to launch free training program for teachers and students on augmented reality and digital safety. And with that, we end the evening news.